MSD Podcast, Head and Neck, Medical Implications and Information, Part 2. There are multiple muscles that are in the cervical spinal area, some connecting the top of your skull with your cervical spine, while others run down the front of your cervical spine. Others connect the top of your cervical spine with the base of your skull. All these muscles and muscle groups are required in armed and unarmed close combat actions on. They provide such functions as stability, resistance, rotation, tilting, turning, lifting, lowering, bending, setting and maintaining posture. They are also essential for extension, retraction, momentum and velocity generation and practically every physical function required for close combat and military self-defense actions on. Just like with all muscles and muscle groups, there are numbers of ligaments involved with the cervical spine. These ligaments connect the vertebrae bone to bone for connection stability. One ligament runs from the skull base down the front of the cervical vertebrae, flexing to oppose backwards force, while another originates at C2, running down the back of your cervical vertebrae to oppose forward force. There are ligaments that run along the rear inside opening of each vertebrae where your spinal cord passes through, providing protection for the spinal cord from behind. There are 8 pairs of nerves that travel through the spinal canal and exit through small vertebrae openings. These nerves perform many different functions, starting with C1, C2, and C3, all directions of the head movement, as well as facial and back of head sensation. C4 controls upward shoulder motion, diaphragm and sensation for parts of your neck, shoulders and upper arms. C5 controls the deltoid muscles of the shoulders and the biceps. It also provides sensation from the upper part of the upper arm down to the elbow. C6 controls muscles of the wrist as well as bicep control and sensation of the thumb part of the forearm and hand. C7 controls your triceps and a wrist function as well as sensation to part of the back of the arm and middle finger. C8 controls your hands and the sensation to your little finger side of your hand and forearm. The term C8 cervical vertebrae is not exactly correct, as there are only 7 cervical vertebrae, but there are 8 pairs of cervical spinal nerves. The C8 nerves come out below C7 and the first thoracic vertebrae. The C8 nerves do not have their own vertebrae. Your spinal cord is like a wiring harness made up of nerve tissue that extends via the brain stem throughout the muscles of your body. There can be wide-ranging injuries to the cervical spine and spinal cord and the muscles, ligaments, and nerves of the cervical spine in close combat through aggressive, hard, heavy, and hostile assault actions on. In terminal injuries of the total destructive type, like on the battlefield where there is a full dislocation at C1 and the spinal cord is severed, this would cause full paralysis of all extremities and all parts of the body and would also cause respiratory failure and death. Full force rotation and extension of the cervical spine, like military lethal neck-breaking type hyperextension, taking the cervical spine completely beyond its normal range of motion, would result in the previous outlined outcome. The cervical spine has normal ranges of motion in bending, forward flexion, backwards bending, extension, as well as lateral side-to-side bending, flexion, and rotational turning. When forced beyond these normal ranges of motion, serious injuries, including fatal injuries, are likely outcomes. Rotational motion and angle beyond the normal ranges or maximum hatchet force type contact are what lead to serious injury or death in battlefields lethal actions on. The vertebral arteries pathway is through the small holes in the 7 cervical vertebrae, providing blood to the brainstem as well as the spinal cord. The vertebral arteries and their branches are vital in the supply of blood to the brain stem, which is vital for bodily functions like respiration and consciousness. Errors in strangulation, arm placement, or a lack of accuracy in striking directed at the carotid sinus that makes contact more to the rear with the cervical spinal column region could affect the vertebral artery by pinching or severing the vertebral artery, cutting off the vital blood supply to the brainstem and spinal cord. The cerebellum at the back of the brain is vital for stability, movement, stance, and posture, and is dependent on the vertebral arteries for its blood supply. In military elite unarmed kill or die actions on, there are multiple means and methods of cervical spinal column and spinal cord destruction employed with both hands or boots. The ear orifice is a sensitive part of the head and not only provides the human sense of hearing, but also is important for maintaining balance and stability. Hard contact impact can send shock waves via the ear canal, rupturing the eardrum, or by military CQC means rupturing both eardrums, causing pain, unconsciousness, and brain injury. The old assassins type spiked weapons, deep penetration via the ear canal can cause fatal wounds, including to the brain stem or vertebral artery that is close to the ear canal. If a spiking stab wound penetrated the skull, it could cause a life-threatening brain injury. The carotid arteries and jugular veins below the jaw, if severed, like in a knife attack, is a very serious injury and without immediate medical intervention would lead to bleeding out and death. There has been doubt cast on Fairbairn's blood clot timings by some in regard to death from a carotid artery severing in about 15 seconds or less. And I can tell you that if they had been instructed by Fairbairn or one of his allied instructors, as I was, they would have been instructed in full detail in regard to the facts of the matter of such injuries under battlefield actions on. I was taught that under such conditions, without immediate medical assistance, the wounded combatant would be rendered unconscious in between 15 and 60 seconds and would die in 3 to 5 minutes. This is due to the carotid arteries moving a considerable volume of blood at high pressure and a fast flow rate to the brain, and through rapid blood loss, there would be a major drop in blood pressure. The brain must have a steady flow of oxygenated blood, and through the severing of the carotid artery, the blood flow is dramatically reduced, quickly interfering with required life support and life-sustaining brain functions. So if not immediately, in approximately 60 or even less seconds, the combatant under a severely wounded actions on the battlefield would not be able to save their own life, and within 3 to 5 minutes they would expire. The fact of the matter, in kill or die battlefield actions on, with overkill destructive skills employments, wounding can lead to regional destruction of not only the primary target, but also other collateral damage targets close to the primary target. The carotid arteries and jugular veins being close to each other under maximum destructive wounding can lead to both being severed, and in a battlefield actions on where immediate life-saving treatment may not be available, the outcome would be fatally bleeding out. Deep stab and slash type wounds can sever both the carotid artery and jugular vein, while superficial cuts might only sever the jugular vein. Then there is the fact of that elite dagger kill or die takeouts of the stab and cut type primarily destroy not only both carotid arteries and jugular veins, but also destroy the airway by severing the throat. The carotid arteries move oxygenated blood from the heart to the brain at high pressure, and as such, the severing of the artery or arteries will result in bleeding out quickly. The jugular veins move deoxygenated blood from the brain back to the heart. Severing the carotid artery can lead to rapid blood loss, unconsciousness, and death due to the high pressure of the arterial blood flow. Severing the jugular veins can also lead to significant blood loss, unconsciousness, and death, but due to the lower pressure of the blood flow loss is not as rapid. The jugular veins move deoxygenated blood away from the head, neck, and face and towards the heart. There are internal and external jugular veins that move blood to other veins, including the subclavian veins. Pressure applied to the carotid arteries, as in carotid strangulation or striking the carotid sinus, causes the baroreceptors, that are sensory nerve endings, to identify changes in blood pressure, and via the vagus and glossopharyngeal nerve send a signal to the brain. The brain receives a false signal that the blood pressure has risen dangerously high and immediately initiates actions to reduce blood pressure, and within seconds, the blood flow to the brain is stopped and fainting occurs. Not only blood flow is interrupted, but also there are some bodily organs functions that are momentarily interrupted. The risk is, if the pressure is maintained after fainting, as in a short period of time of several minutes or more, a life-threatening situation will be unfolding that can end in death. The eyes are delicate human senses that, if poked, cause autonomic reactions of the self-protecting type, blinking, closing the eyelids, and moving the head away from the direction of the incoming action. Hard fingers, thumbs, or spiking implements can cause a range of eye injuries, including permanent blindness. The bone at the back of the eye is thin and can be penetrated by a spike-like implement or hard fingers or thumbs that could cause brain injury. Hard, deep penetration of the eye would most likely damage the eyeball or important parts of the eye, including the lens, retina, iris, optic nerve, or surrounding muscles. Outcomes can be partial or full loss of vision, as well as eye infections and other complications. The glabella, or as it is known in mill CQC, Black Death, is a centre-line, slightly raised part of the skull between the eyebrows, like a vertical ridge where the two brow ridges meet. While this part of the skull is not considered a weak spot, it is by its location in relation to the front lobes of the brain. When it comes to hard, blunt force trauma impact to the front lobes of the brain, makes it a target that directly can affect brain functions. The Black Death mill CQC term is related to a decked enemy and the end of the rifle butt downward smashing contact impact. The shock force transfer and the internal dynamic brain movement can cause concussion, brain injury, damage, and death. Similarly, the orbital circular ridges of bone around the eye sockets under heavy contact impact can fracture and generate dynamic force to the front lobes of the brain, causing concussion, brain injury, or death. The bridge of the nose is reasonably thin and can be broken or shattered by impact, and while it is not generally considered a life-threatening injury, it can cause pain, considerable bleeding, and as a result, breathing difficulties. A combatant should never blow their nose when they suffer a broken nose under actions on, as it can cause their eyes to swell and even close. The upper part of the nose is bone, and the lower nose and nostrils are made of cartilage. The nostrils, being orifices that include the nasal cavity, have extremely sensitive nerves, and in mill CQC are targeted by digital penetration to force a hold release as well as manipulate the head. Cheekbone heavy contact impact can result in fracture or displacement that can require surgery for realignment and stabilising. I remember back in our in-house bare knuckle days, a lad getting his cheekbone displaced and going on to beat his opponent before heading to the hospital and having a realignment operation. The jaw or mandible, by its design, can absorb impact contact by head movement, fracture or dislocation, or can transfer the force to the brain. The primary point of impact in contact impact trauma is on the lower edge of the mandible, approximately 2 inches or 5 centimeters from the chin point. Outcomes range from fracture, dislocation, concussion, through to brain injuries and death through head and neck contact with hard surfaces, edges, and protrusions. The chin jab for battlefield actions on with the palm heel has been a deadly battlefield actions on skill since Alexander the Great was a prop forward for Macedonia. It can cause serious brain and neck injuries as well as dislocating the skull from the top of the spinal column, causing certain death. The thyroid cartilage can be crushed by a reasonably low to moderate level of impact contact or crushing choking pressure, as well as hard, heavy contact, which can be immediately life-threatening. The crushing of the thyroid cartilage can cause swelling of the soft tissue of the throat to the point that the windpipe swells closed and death follows by suffocation. The sternal notch is located at the base of the front of the neck and has a skin-only layer of protection for the trachea, and direct impact can crush the trachea cartilages, resulting in death. Sharp edge penetrating injuries causing bleeding into the trachea can make breathing impossible and cause death by choking on one's own blood. The Adam's apple is the prominent part of the thyroid cartilage and protects the voice box. If fractured by contact, impact, and airway obstruction can be caused, as well as damage to the vocal cord. The forceful, deliberate targeting of the throat in a military battlefield actions on, including when the head and neck has been seized and secured, could end in a fatal outcome. Such hard striking can damage the trachea, known as the windpipe, the larynx, known as the voice box, or the laryngeal prominence, known as the Adam's apple, potentially making breathing difficult or not possible, as well as causing internal bleeding, and as such, destructive injuries can be fatal. In cases of severe throat trauma, an emergency tracheostomy can be a necessary life-saving procedure when other methods of securing the airway have failed. There are many sensitive and life support targets in the head and neck, and hopefully part 1 and part 2 of the medical implications to wounds and injuries to the head and neck will provide important information, especially in the protection of the head and neck under actions on. And as everyone is responsible for their own actions, the targeting of head and neck delicate targets in human senses, as well as life support systems, can cause serious injury or death, and the combatant must understand this before targeting such life-threatening targets. Under rules of engagement and civilian laws of self-defense, combatants and civvies are responsible for their actions and the outcomes of their actions, and as such, knowledge is power, both in objective achievement and in life preserving.